Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about companion diagnostics, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss indicative repertoire, knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the 14th subsection of the second section, demonstration techniques, called companion diagnostics. The portfolio offers indicative repertoire for this subsection that includes estrogen receptor, progesterone receptor, HER2, PD1, PDL1, ALK, ROS1, BRAF V600E. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is pathophysiology of estrogen, progesterone, and HER2 receptors. Candidate needs to have the knowledge and understanding about pathophysiology of ER, PR, HER2. You could ask the candidate to explain what ER, PR, HER2 receptors are, what is their role in healthy tissue, how does their functions change in diseased tissue, what diseases are they associated with. When addressing this knowledge requirement, candidates should consider binding of receptors, activation of receptors, signaling pathway, proliferation, differentiation, uncontrolled cell proliferation, hormone resistance, uncontrolled cell survival, associated diseases. The second knowledge requirement is role of prognostic markers in disease management in breast and, additionally, for HER2 in gastric cancer. Candidate needs to have the knowledge and understanding about prognostic markers. You could ask the candidate to explain what prognostic markers are and what role they play in breast and gastric cancer, to list examples of prognostic markers. When addressing this knowledge requirement, candidates should consider prognosis, prediction of treatment response, prediction of recurrence, predicting aggressiveness, guiding therapy, or classifying cancer into molecular subtypes. The third knowledge requirement is principles and practice of prognostic marker demonstration. Candidate needs to have the knowledge and understanding about demonstration of predictive and prognostic markers. You could ask the candidate to list methods to detect predictive and prognostic markers, to explain the principles and practice of those methods, name diseases that can be managed by those markers, to explain how the positive staining would look like and mean for the patient. When addressing this knowledge requirement, candidates should consider the markers highlighted in the indicative repertoire and markers used in their department, the principles of those markers demonstration, their methodology, the practical application of those markers, reagents used and why they are used, control material, how the positive staining would look like, associated diseases and so on. The fourth knowledge requirement is review cases and material microscopically for internal quality control and external quality control. Candidate needs to have the knowledge and understanding about microscopic examination of stained slides for IQC and EQA. You could ask the candidate to explain how to assess quality of relevant demonstration methods, to explain the need for controls, how would assessment be done by EQA assessor, to list quality criteria used by EQA schemes, how to record the process. When addressing this knowledge requirement, candidates should consider staining consistency and intensity, specificity of staining, uniformity of staining, presence around staining, contamination or deposits, presence of nonspecific staining, EQA assessment criteria, control material used, documentation. The fifth knowledge requirement is principles of quality control and assurance, relating to false positive and false negative rates. Candidate needs to have the knowledge and understanding about quality control related to false results. You could ask the candidate to explain how they would assess quality of demonstration methods, to list causes of false positive and false negative rates, to explain how false results can be minimized, to list approach used in your lab to minimize false results, to explain the impact of false results on patients. When addressing this knowledge requirement, candidates should consider effects of pre-analytical aspects like tissue handling and fixation, analytical aspects like antibody choice, staining method, controls, specimen type as resections have higher rate for false negative, interpretation variability, intertumoral heterogeneity, stain validation and verification, outliers identification, interpretation thresholds, equivocal cases, case volume, standardized demonstration protocols, observer bias. Technical issues, training, competence, following SOPs, or participation in EQA schemes. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is follow demonstration method protocols accurately and safely. Candidates should be able to accurately and safely follow demonstration methods. Does the candidate perform relevant demonstration methods safely and accurately? Do they follow relevant protocols and SOPs? Do they use or automated method? Do they know if the demonstration method was followed accurately? When addressing this competence requirement, candidate could consider SOPs, method used, quality control, use of control material, training, competency, importance of following protocols, method reliability, consistency, reproducibility. The second competence requirement is select and use the appropriate control materials, maintaining appropriate audit trail. Candidates should be able to select and use correct control material for demonstration methods and maintain audit trail. Does the candidate use correct control material for relevant demonstration method? Do they maintain correct audit trail for control material used? Do they produce appropriate control material for each demonstration method? When addressing this competence requirement, candidate could consider tissue types, verification, validation process, record keeping, traceability, audit trail, importance of selecting correct control material, consequences of not using correct controls. The third competence requirement is identify stained companion diagnostic markers present in different tissues. Candidates should be able to identify companion diagnostic markers on a stained slide. Can the candidate identify those markers on a stained slide correctly? Do they use correct microscopic technique to identify them? Can they identify the demonstration method used to identify those markers? When addressing this competence requirement, candidate could consider microscopic examination of stained slides, demonstration method used and the target cells expressing those markers, how the staining would look like on a stained section, their training and competence. The fourth competence requirement is assess stained sections for quality. Candidates should be able to assess quality of stained sections. Does the candidate assess stained section for quality correctly? Do they take correct steps during the assessment? Do they focus on correct features when assessing quality of staining? Maintain appropriate audit trail? When addressing this competence requirement, candidate could consider staining intensity and uniformity, specificity and sensitivity, presence of background, consistency of staining, presence of nonspecific staining, staining intensity, EQA assessment criteria, relevant documentation, control material. The fifth competence requirement is resolve any associated problems with the staining methods including root cause analysis, as appropriate. Candidate should be able to troubleshoot staining. Does the candidate resolve problems with staining correctly? Can they identify and solve the common problems? Do they record problems and results accurately? Can they perform root cause analysis? When addressing this competence requirement, candidate could consider investigation, problem identification, corrective actions to fix the issue, preventive actions to minimize problems from reoccurring, possible problems like poor staining intensity, poor specificity of staining, artifact like uneven staining, hazy slides, presence of deposits or precipitate on the slide, reagent contamination, effects of fixation, processing and antigen retrieval on quality of IHC staining, nonspecific staining, background, absent staining, cross-reactivity. The sixth competence requirement is dispose of waste reagents safely. Candidate should be able to safely dispose waste reagents. Does the candidate dispose staining reagents safely? Do they follow local procedures and avoid risks associated with staining reagents? Do they segregate waste as per regulations? When assessing this competence requirement, candidate could consider licensed contractors used by your lab, waste segregation, safety data sheet of reagents that often state disposal ways, risk assessments, local policies, and regulations that are followed, health and safety risks associated with reagents like flammability, corrosivity, environmental toxicity. The seventh competence requirement is monitor ongoing consistency of staining of companion diagnostic markers. Candidate should be able to monitor consistency of staining. Does the candidate perform monitoring of ongoing staining consistency? Do they record the monitoring correctly on relevant documents? Do they maintain correct trail for monitoring consistency of staining? Do they deal with possible issues with staining consistency correctly? When addressing this competence requirement, candidate could consider controls, positive and negative, cell lines, quantitative assessment, AI analysis, data tracking, statistical analysis, EQA, IQC, and competence, standardized controls and calibration, continuous quality assurance, reagent lot testing, validation and verification, audit trail, documentation. The eighth competence requirement is use semi-quantitative scoring, H-score and quick-score, and methods for scoring HER2 staining in accordance with current best practice guidelines. Candidate should be able to use relevant scoring methods. Does the candidate use H-score and quick-score scoring methods? Do they use those methods accurately? Do they follow the local scoring protocols correctly? Do they follow the current best guidelines to use semi-quantitative and HER2 scoring in practice? When addressing this competence requirement, candidate could consider each scoring method, calculation formulas, application and validity of those methods, current guidelines, automated via digital platforms available like ChewPath, Halo, or EndoNet, their range, sensitivity, proportion or use. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence, relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. You could ask the candidate to complete tables you created, based on knowledge requirements. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific, and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.